My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Welcome back to the 8th Annual CR Arthritis Event. Today, I'm joined by Christiane Azar, Physical Therapist and Clinical Coordinator at the Lethbridge-Layton-Mackay Rehabilitation Centre in Montreal. Her research interests include participation and social inclusion in rehabilitation services. Welcome, Christiane.
Thank you. Thank you, Ellen.
Christiane, you sit in an extremely important role doing coordination or rehabilitation. Can you tell us about how you are involved in rheumatology?
So I graduated a long time ago, but I started at the Lethbridge Rehab Centre in 1994 on the rheumatology team. And what was very interesting for me is that I had to interact with different professions in order to offer the interdisciplinary approach. And at that time, the center was already functioning in programs. So it was not like physio department and occupational therapy department. They were all teams by condition. So the rheumatology team was a separate entity in the center, and there still are other programs defined by the diagnosis that the client is referred to us. So I am a clinical coordinator since 2006, and I love rheumatology because as a physiotherapist, I used to feel that I can give so much to our clients and teach them a lot, but also all what I learned from them, from their own experiences, was like a treasure for me, and I was able to learn more and more about traumatic conditions. So I still learn from my other colleagues and co-workers from other professions, because we are evolving and really helping the client to work with us, because we don't work with them, they work with us, and it's bi-directional at that level. And also we work with the health professionals who are involved in their care also, and also we work with their important person around them. And since I've been on that team for a lot, forever, let's say, I had the experience also of the pre and post biologic eras with rheumatic diseases. And I can't believe all the improvement in the quality of life after all the medical advances and everything that helps the client to manage better and have a better life with their disease.
Christiane, I just, think your expertise and your experience are so invaluable. And like you said, you've been in this field for so long and been able to see all the improvements, but also contribute and to implement all of these improvements. So that's, such incredible work that it sounds like you're doing in Montreal. I would love to learn more about this incredible rehabilitation center.
Yes, we are very lucky to have this organization and this setup in our day-to-day intervention. So it's very helpful to reach out also to some other programs that are in the center. So sometimes we refer our clients to a driving evaluation. We have access to career counselors. We have also access to the technical aid services for orthotics or any other technical aid that they might need. So it's very facilitating for the journey of the client with us.
Extremely multidisciplinary, and it also sounds like you almost act like a liaison service of then finding and roping in other professionals to be a part of this journey.
Exactly, and we work hard to ensure the access to our clients who are on our waiting list, and we work as much as possible to decrease the waiting time also. But it's not easy with all with all the obstacles that we might have in a public system too.
Yeah, absolutely. It sounds like you guys are really leading the charge, though. That's really, like, I've never really heard of such a center doing such great work.
Thank you.
My next question for you is, I do know that you led a wonderful course at the pre-course. During the pre-course, I was actually able to attend. Could you share or give us a little bit of an overview of the section that you led?
Well, the presentation on January 28th was to help demystify a bit the application for disability, and to be sure that what we're doing is helpful for the client. So a lot of our clients have a lot of visible symptoms, but a lot of the other invisible symptoms like energy, decreased energy, fatigue, and all the stress that can come with a new diagnosis, and with adjusting medication and being able to explain all this to their significant people around them. So sometimes the health professional will refer the client to us, but the client is working and won't be able to see where he can fit a rehabilitation program. Or again, like Dr. Hazel explained, what are the situation where a client would be allowed to think about the disability and be supported by an application from his doctor. So it's sometimes just to ensure financial security and give them the chance also to, on a different angle, participate in their rehabilitation. So that was the key, one of the keys that were in our presentation. And we know that managing our energy in a regular situation is hard these days, and it's very demanding. But somebody who has decreased energy because of the disease also has to focus sometimes to be able to manage that in order to facilitate other things. So energy management is a key factor to help the client manage their condition in general, and also to be able to have a successful rehabilitation. And again, we know that each client is unique with his or her situation, and this, for sure, the decision is shared between the doctor and the client to see what are the benefits of applying to disability or not applying to the disability. But sometimes it could be crucial that they apply for a disability in order to give them a minimum of a quality of life, and then be able to focus on other challenges within rehab too. So our role also is to support the treating doctor to with our reports and our progress notes during rehabilitation, in order for him to back up, or if he has some parts that are missing, that he doesn't know the capacities of the client in details like we do. This role will be for us to support the doctor in completing the form.
Like you just mentioned, it's when you receive that diagnosis, it's not just you received a diagnosis, it's wow, this is overwhelming, there's so much information, what do I do? And to be able to offer, support through the process, but not only support for the individual, their family, but also, like you said, teamwork between all the allied health professionals is so key to ensure that this journey is as smooth as possible, shall we say. That's so important. So thank you. I found that that session so informative.
Thank you. So again, our role at the center is rehabilitation that is focused on social integration, which means we want the client to continue doing his normal, if I may say, normal roles in his family, in his work, in his surrounding. And if they stop doing these activities, to be able to resume activities, whether it's the same activity or different way of doing the same activity. So this is the role of our, the mandate of our center. We need to get them back and stay in the community, in the society, and this is what we call social integration.
I can now understand why you have such a passion to do research in this area. The psychosocial lens that your center takes on this, I think, is really what medicine is now moving towards. And like you said, I think it's a beautiful progression. We've definitely taken steps forward to understand kind of what rehabilitation encompasses.
Yeah, for sure. Like it's really different than the inpatient rehabilitation, because again, in the part that I shared on the presentation on January 28th, it was really important to explain that in an inpatient rehabilitation facility, they will look at all the factors that impact the life of the client or the patient, but the patient is in a facility, he's not in his own milieu. Whereas when we start doing the rehabilitation in an outpatient department, it's again real life, real factors that are important to the client, and the client will see the facilitators and obstacle and will give us feedback in order to help him manage these two parameters, let's say.
Yeah, it's very, very interesting, right? Because like you said, it's so different inpatient, outpatient rehab. And in the outpatient, there really is that almost like a negotiation process of let's work together. This doesn't work. Let's problem solve.
Exactly. And the client, we call them client because they come and take services from us.
I like it. Client.
Like we take care of them. We care for them a lot, but we don't take care of them in the inpatient understanding, let's say, or in a hospital setup. So we want them to be the main, the most important. They have the most important role in their rehabilitation. We stay as coaches. We guide them. They try things. We come back. We discuss things, and again, it's going to be the best decisions for to set up rehab goals are really patient-centered decisions. So it's they're very important in what we do.
Wonderful. If you ever need somebody to help out, I'm ready to move. I'm ready to move from Montreal. Please expect me next week.
You're welcome.
And as you know, and you've already touched on this so beautifully, but the theme of this year's scientific meeting is equity, diversity, inclusion, and how can the healthcare system, so not only, as you said, clients, providers, all the allied health professionals, how can we really embody these concepts in our everyday lives?
Well, it could be like separated at 3 levels because we have all our roles, and but we are also in a setup in the society. It's not like I have my own boutique to sell things. So for the client, access to an interdisciplinary team is very important, and this is what we are fortunate to be able to give at our center and in our CUs. And equity is really the core of what we do, and also you heard about it during the presentation. So this is very important. And the inclusion and the diversity. We are in a multicultural city, We have clients from multicultural backgrounds. We have therapists from multicultural background, and we do our best because like clients who do not have a functional English or French, we want them to understand what's going on. It's not only that we give them exercises or tools, or we give them like tips. It's not enough. So we are also very lucky to have access to a bank of interpreters that are covered by the government. So we ask them to be with the client for at least the evaluation, and then if we see that we can manage, we will let go. But sometimes the interpreter will stay in the rehab process as long as needed, because also family members, sometimes they're busy also, or they cannot be very objective in what we are explaining or what the client is explaining. So it's very helpful. And also sometimes if it's something easy, we have, as I said, therapists from with other languages than French and English, so we can reach out for really little things. But the main thing is the bank of interpreters who help us a lot also, and we are lucky to have access to that. And again, why we have waiting lists, and this is another issue. We want to have no waiting list, but it doesn't work as hard as we can work. And some research showed that when we have intercultural rehabilitation or interactions, rehab can take like up to 40% more time than regular interaction, if there's no cultural factors, if there's no linguistic obstacles. So it takes time to provide also good quality of rehabilitation and services. And during COVID, we were able really to let's say, use all the technology that was there, but we never had the chance to think about it really seriously. And that helps a lot to facilitate some interventions, so the client doesn't come at the center unless he needs to come. And like there are some disciplines where you can not do it virtually, so the physiotherapy or the orthotics or other interventions with the family, or so but we have now in our toolbox, we have all the virtual access, and we use it now, and it's part of our routine now. It's not like, okay, during COVID. No, we're gonna continue to put that in our toolbox and use it when it's pertinent to use it.
Absolutely. Like you said, I think at first we thought virtual care was a temporary substitute, but now we realize we can, for some people who find it difficult, they don't have the hours in the day, it actually provides not to say better care, but it relieves all of the other stress of getting to the appointment that truly actually is in a sense more beneficial to them. And looking at kind of those three components, equity, diversity, inclusion, in all the multiple lenses that you've kind of considered, understanding that, you know, yes, language is a barrier. Yes, it takes more time, more resources. But if we're really thinking about quality rehabilitation,
yeah,
that's what we're going to go for. I'm just like, hats off. What fantastic work you do.
Yeah, so that was mainly like focused on what goes directly to the patient, to the client. And regarding the team, what helped us a lot is that we have the chance to give room to the patient to talk about his difficulties, his facilitators again, and talk about his milieu. And like the first thing that we do on the rheumatology team is we meet with the client for the first time, It's with Dr. Hazel, our consultant, rheumatologist, with a social worker and myself. And you would be surprised how the client could, because we're leading him in a trusty way to open up, and how surprisingly, like we're three strangers in his life, and they talk about it because we understand the situation that is impacted by the rheumatic condition and symptoms. So it's really how can I say, it's very rewarding to us, because this trust is very important from the patient towards the team. And also, like with motivational interview guidance, we get to have the problems exposed and then the problem solving to explore. So this is also very important, that it's not like a protocol that okay, this is what goes on this disease and this is what goes on this situation. No, it's really very unique to each patient. The rehab is very individualized.
Yeah, and offering those tools and skills to the practitioners as well, right? Motivational interviewing, being trained to be able to do that, right? Going in and providing time, I think so important. I think trust building takes time, and unfortunately our healthcare system isn't the best at doing that, but that you're able to offer that there is so key, and that's something I think your entire team values, right? All of the health professionals value.
Yeah, and regarding the health system in general, the healthcare system in general, it should be like really a teamwork between the clinicians and the intervenant, and also with all the deciders in the system, and to show the importance of the accessibility to an interdisciplinary team for each client who needs it and who's ready to engage rehabilitation.
Wonderful. Awesome. And with that, if I am somebody in Montreal, where do I go to seek your services? Or if I'm somebody who maybe lives across the country, where can I go to find some resources, learn more? Do you have any suggestions?
Well, for sure, like there are a lot of association and resources, and that accessibility via internet is very easy, and it's always important to go to reliable resources. But again, like for our team, it's like where we cover the services for the entire island, like Montreal, the city, like the big Montreal. Because we are the only team who provide these services. So actually, it's sometimes we have calls from other like CLSCs or community facilities, and they know that we have more special, like more experience in rheumatic diseases. They will call us and we'll give them knowledge transfer and knowledge sharing is important. So this is what we can do on our side.
Thank you. So with that, Christiane, I want to thank you so much for your time and really taking us through the way that you approach rehabilitation.
Thank you. Thank you very much.
Please congratulate your team for me as well. And I want to thank all of our viewers for tuning into this episode. And I hope you guys stick around and check out the rest that will happen at the CR Arthritis Event 2022.